I'm Anja from Yoga Embodied. This video is for all my students who are pregnant, and it's also for my fellow yoga teachers who are very often asking the question whether they can continue teaching their pregnant students. And first of all, if you're pregnant, congratulations. It is a really special time, and for some women it's a time, especially the first trimester, where they feel they just really want to be on their own, they want to nurture their pregnancy, and it's often a time of insecurity because you realize this has happened, whether it's a surprise or you've been trying for a really long time, and it takes time maybe to understand these changes. You might not understand it until your baby's grown up, but it's also a time, obviously there are huge changes in the body, hormones are changing, your body is changing. So it might be a time where women feel like they don't really want to practice. They might be nauseous, have heartburn, or just feeling completely fatigued and tired. And if you're tired, you simply need to rest. However, some people want to move. They might feel slightly different, but there's no reason they feel they shouldn't continue with their regular yoga practice, or maybe you have a different practice like running or going to the gym, weightlifting. So I cannot comment really on other practices rather than yoga, except the NHS recommends you can continue with exercise that you're used to. And the NHS also recommends that the only things that you might consider changing is if there's a possibility of falling, like if you're riding on a horse and you fall, or you're cycling and you often fall. Obviously cycling in normal traffic is fine. If you do combat sports and there's a risk of someone kicking you in the abdomen, it's obviously not a great idea either. But yoga practice is fantastic. There are some things that you might want to change during this time. One of the misconceptions around yoga and pregnancy, or yoga in general, is that a yoga teacher says, just listen to your body. And yes, we do need to listen to the body, but during pregnancy there's so many changes to the body. It doesn't talk the language it has done throughout your life, it's changing. Some of the changes are that you have higher levels of a hormone called relaxin in the body. That hormone is there, at the very high levels of it during pregnancy is there because your body is changing. The relaxin accommodates for that openness of the body. It allows the ligament to stretch more than usual. And that's perfect because your abdomen is going to expand. Your pelvis has to expand so that you can accommodate for your baby and for the birth. So it's a beautiful thing. But relaxin is in the bloodstream, so it goes to all our joints, which means that it can be very easy to hyperextend during pregnancy. Not just in the pelvis, but for sure pelvic pain is something that we really need to consider during pregnancy. So a general rule of thumb during pregnancy is that when you stretch, you don't stretch 100% anymore. You go to maybe 80% or even 60% if you have a tendency for hypermobility. The other thing that we sometimes are worried about is too deep twisting, too deep forward bend, or too deep back bends. So we allow a little bit more space. So in the too deep back bends, the lumbar spine already starts to curve during pregnancy because the body is changing. So the lower back has a bigger arch in pregnancy. That can cause some kind of compression to the nerves, and generally just backache. So we still need a little bit of support to lengthen the lumbar spine. So deep back bends, again, it almost creates a pressure for the front of the abdomen, which means the abdominal muscles open up, which again they will do during pregnancy, and they will do even more because of the ligaments and the high levels of relaxin. But too much opening or more more than maybe what the body would do on its own is potentially not appropriate, because we can start to get abdominal separation. That happens quite a lot in pregnancy, and luckily for most women it kind of moves back in after a while, after they give it birth. But again, you don't want to create too much openness in the back end either. Some of the things that we do with twisting is absolutely fine, but the deeper twist, where we have a close twist where one of the legs are very close to the abdomen, again, in the end there's no space for that, so we simply create more space. The feet can become wider, or maybe we simply twist in an open twist. Maybe baby or navel is facing forward, and you accommodate for the twist in the thoracic spine, because the upper body usually tends to become quite tight for all of us, but more so in pregnancy, because everything is growing on the front, not just the belly but the breast as well. Deep forward bends, again, there's no reason to push down on a big bump, a growing baby. You can accommodate and give more space. So pregnancy is not an illness, it's not an injury, but it is a condition where the body changes a lot. So during pregnancy we do need to be aware of the physiology and how things change. As a yoga teacher, I would absolutely recommend that if you do accept pregnant women in your class, that you do your research, you go to a pregnancy teacher training course. Myself and two of my colleagues, Lisa and Claire, from Engineer Yoga and Yoga Bright, we created a course to show and to share our experience as pregnancy and postnatal yoga teachers, how to accommodate and understand the physiology, why we need to accommodate our pregnant bodies in the classes, or postpartum bodies in the classes. So these are just a few things. There are things that we shouldn't do or might not be appropriate in a pregnancy for someone that's already experienced in yoga. And even holding poses longer is another thing. Like, we think yin yoga is a beautiful practice, but you do hold the pose for a long time to accommodate the ligament to release. And in pregnancy, that's just not appropriate. You can still stay in a pose for a while, but for 7 minutes, no, it's too long. The ligaments stretch, and ligaments don't have a lot of blood supply, so they might not come back in again as they should. So that was just a little rambling around pregnancy in yoga classes. I'm very happy to have pregnant women in my class that I already know. Even at the moment, I think I have 5 pregnant women that come to my regular classes, and some have transferred into my to my prenatal class specifically. But happy to move around. You can still be strong. You can still move. You can still breathe. You can still challenge yourself. But being mindful that during pregnancy there are high levels of relaxin. You will have a tendency to hyperextend. So use your muscles to support your joints to create strength and stability. I hope that offers some sense of ideas of how you can accommodate your practice. If you are pregnant, do tell your yoga teacher. If you are a yoga teacher who invites pregnant women into the class, please do have some kind of training so you understand what actually happens during pregnancy, because unfortunately there's a lot of misconceptions around it, and it's always good to actually understand the physiology. So have a wonderful rest of the day, and do let me know any questions you have. Put them in the comment box, and enjoy your practice. Namaste.